said to Peter Bush this last week, well, I haven't got 50 employees, so I don't need to do a risk assessment. Actually, yes, we all need to do it. It's just the publication and whether it's got to be written that varies between the size of businesses. Okay, so that answer your question, Mike? Yeah.
Answers mine, yeah.
Yeah.
I'll move on.
Okay, they have actually changed the reporting of injuries, diseases and dangerous occurrence regulations to take account of COVID. So when an unintended incident at work has led to someone's possible or actual exposure to coronavirus, we have to report that as a dangerous occurrence. If a worker is being diagnosed as having COVID and there's reasonable evidence it was caused by exposure at work, then we have to report that as a case of disease. And obviously if somebody dies as a result of occupational exposure to coronavirus, that's reportable under RIDDOR as well. This is going to be very, very difficult to prove. I spoke to HSE inspector who I have close links with, and she was of the same opinion. It's going to be, they're not going to be able to prove it because obviously COVID or corona is everywhere. So how you prove that you got it from the workplace is going to be very, very difficult. So I really don't know why they've done that, but they have. Okay. Next slide, Mike, please. Okay, so the health and safety executive are being very pragmatic and practical. They want to help people be in production, and they distinctly want to help keep businesses open. The initial statement on their website when the coronavirus started to come out was the only businesses that had to shut were non-essential retail and public venues. So all other companies they expected still to be in production. So they want to try and help you get back to work. So they're going to adopt a pragmatic approach to enforcement. They are quite practical. They're feeling their way through this new situation as well. So they haven't actually got strict guidelines that they're enforcing to. So as long as they feel that as a business, you've looked at it and trying to manage the risk, they will help you. So one of the main things I want to encourage is obviously home working, which was one of the main things that happened at the beginning of the outbreak. A lot of people were sent home to work. Obviously that mitigates the risk in the workplace itself by reducing the numbers on site. Okay, next slide, Mike, please. Okay, so the practicalities of what they're asking us to do, first of all, is to reduce the number of people on site if we can. So look at home working possibilities. Obviously, people that are in production environments and engineering, they can't actually work from home unless they're office based. So you need to look at those people that possibly can work from home. Reduce the number of visitors to site. So we don't want sales reps just turning up on spec or anybody come in that we don't necessarily need at this moment in time. Contractors coming onto site should only be for essential works. Anything that's routine or non-essential, if we can postpone that to a later date. However, the HSE have issued a guidance to say that we must let inspectors in to undertake statutory inspections. So if we've got any lifting equipment and requires inspecting under LOLA or air receivers or anything like that, they must be inspected. There is no leeway with that. So even if your business is closed, they expected you to open up the business to let the inspectors in. So the other way is looking at splitting staff. So that would also protect the business if COVID infection does occur. So if you put some of your key management at home and some still in the workplace, then if we do get an outbreak in the workplace, then not all your key people are going to be off at the same time. So it's looking at business continuity as well as health and safety. Okay, next slide,
one of the things on there,
yeah.
So is on unfurloughing, which might bring Kat in, deciding who to bring back in. If you've got A and a B team working at different times, could you bring back an A team in, and then if it goes quiet again, furlough them again, and then bring B team in? Is there any kind of thoughts on that, Kat?
So in terms of furloughing and unfurloughing, yes, first of all, you absolutely can do that. Just because you've brought people back doesn't mean you can't re-furlough. So in terms of from a claiming under the job retention scheme perspective, it would be about making sure that to be able to still claim your 80% as it currently is back, you would need to make sure that people are on furlough for a 3 weeks minimum to qualify still for your furlough payments through HMRC. But in terms of thinking about who you bring back and in what order and how that works, it's got to work for your business in terms of how you work. So if that's looking at an A team and a B team, and alternating between the two, or whatever that looks like, as long as it's fair and it's consistent in how you approach it, then it's fine. You've just got to be mindful of just thinking about, firstly, what works practically for your business, but also, you know, kind of what's fair and consistent in your approach to deciding who to select.
Yeah. And another point that somebody's made is increasing shift patterns, so not all arrive and leave together, and splitting break times and things like that.
Yeah, we'll cover that later on. Yeah, staggering breaks is one way of controlling it. Starting different start times. If you've got a clocking in machine that people have to queue up at, things like that, you can stagger your start times to take account of that. And that's one of what you look at in your risk assessment, which we'll talk about in a little while.
Right, I'll move it on.
Okay. Yeah, okay, obviously under people, we obviously need to identify if we've got any vulnerable people. So people with diabetes or people with other health conditions that may have been given a 12-week letter. So obviously we need to ask that question of our workforce, is there anybody in this situation? Obviously, if they are people who can't work from home, then they would obviously need to be furloughed or, you know, or not allowed back into the workplace until the 12 weeks is up. I don't know, I've had quite a lot of discussions with clients this week, because obviously the 12-week letters came out in March. So we're coming at the end of June to the end of that. Whether they get another 12-week letter, we don't know what's going to happen yet. It depends obviously on the situation regarding the number of deaths, etc., and where we are on the curve, I would imagine. Okay, visiting drivers. So obviously when this first happened, what a lot of people did was not allow visiting drivers to use the toilets and welfare facilities on their site. HSE was soon to stamp down on this and issue guidance that you must allow access to welfare facilities. If you have drivers that are coming in, doing deliveries and are out about all day and they ask to use your facilities, you must allow them. So what we've done at some companies is, where we've been lucky enough, we've just designated one toilet for the visiting drivers. If you're not in a situation where you can do that, then obviously once they've been in, the toilet would need to be cleaned down before somebody else uses it.
Yeah.
Okay.
Somebody was asking if they needed to be accompanied while they were on site as well.
Not particularly, no, unless you've got a security reason why you don't want them to be wandering around, if there's stuff, you know, that they can steal or you don't want them to look at. But from a health and safety point of view, no, that they're fine as long as they know the way to the facilities.
Yeah. Okay, so moving on.
So first aid, obviously in this situation, the HSE have recognised that first aid cover may be affected. So people who had a certificate that expired on or after the 16th of March this year, that has a 3-month extension automatically. And I would imagine, again, depending on what happens, well, I would imagine definitely they will issue another 3-month extension, because you won't be going to sit in a training room and sharing a mannequin between each other for a little while yet. So this may affect our first aid cover as well if we bring in splitting the shifts, etc. So HSE will be mindful of this. So it may be that we might just have to stop some higher risk activities, but all we have to have at all times people are at work is what we call an appointed person and a first aid box. And the appointed person's job is simply to summon help in the event of an emergency. They do not need any first aid training. So we can just make usually the supervisor or the most senior person on site the appointed person. Okay, thank you, Mike. Have you got a question?
Yeah, just on that, stopping higher risk activities. So if people do the things, you know, it's a chance to look at, you know, whether you do need to do the things that are higher risk, so that you're making less opportunity for health and safety to come up.
Yeah, definitely, yeah. So the controls are still the same. The HSE guidance, when it came out last week, hasn't really changed what we were doing previously. So the main way of controlling corona is through your 2 metre separation and good hygiene. So we need to look at our each individual workplace. Can we achieve this 2 metre separation? So if we can't do that, then we need to look at perhaps putting physical controls in place, so some perspex barriers. So we've solved a solution for one of our clients where they had to be in close contact with each other by putting a perspex barrier in the way for the time that they were having to be face to face and within the 2 metres. So, you know, like the barriers that you get in the supermarket, they've gone up now. So things like that, we can use them. Companies are manufacturing barriers between desks. If you've got desks facing each other that you can't rearrange and you can't move about, then if you have to have those people close and facing each other, then there are barriers that you can fit onto your desk now.
Yeah, and I think that particular one will cover some of the points raised in that project later on in what we're doing as well, because he'd got guys who didn't want to work or expressing a lack of willingness to work because they were citing the potential dangers. He was trying to be seen at least as being a kind of caring employer, looking after you know, his duty of care towards his employees. But he'd got contracts that he needed to fulfill. He was doing work in the glass industry. They were 24/7 operation. He was feeding into that. And so he got the work which he needed to do. And it got guys which there was an element of whether they were actually happy to sit at home on 80% rather than coming to work for 100%, and raising the kind of objections as to why not. But what we were able to do, Sarah and myself between us, was put a good engineering solution in place for how we could actually do the work, but put a barrier in place. And so if we put a barrier in place, and then they could do the work. So he contacted us on the Wednesday, and by the Friday everybody were back at work, and he was an extremely happy MD that he got his people back in, and he was being seen as being a sort of, you know, caring employer who was looking after the health and well-being of his workers, not just saying yes, you've got to come in and do it. So there are ways of looking at this.
Yeah.
So yeah, if you can't use those physical controls, it's a case of at that point looking at PPE.
PPE, yeah. So with regards to your PPE, you're looking at things like gloves. But obviously, if we're using gloves, we don't want to cause any other health and safety issues, because gloves can sometimes, you can lose your dexterity and then you're not able to do the work safely. So if you can't use gloves, and it's looking at hand gel and keeping your hands clean in between touching things that other people may have touched. Masks, they have limited use outside clinical settings. There's no scientific evidence that they provide much, if any, protection. So if you're going to go down the mask route, it's more really to give the employees a bit of security for themselves, how they feel. In terms of actually protecting them from coronavirus, there's not much that they do. And if you do provide masks, you have to have face fit testing. So you can't just go out and buy a load of masks and issue them out. So they have to be face fit tested, which is a cost. You have to have somebody come in and face fit test every single person, because they need to be fitted properly around here and round this. They need to know how to do it. And I passed a man in their van yesterday, and he got a mask on, and he was the only person in the van, so it was not helpful anyway. But also he got the fit bit that goes around your nose at the side of his mouth, on his cheek, so it was all exposed anyway. So there is a lot of issues with masks that, you know, and also they don't cover your eyes, so the virus gets in through all your mucous membranes, so that closes your eyes. So if I'm advising clients, I'm advising them to use a full face visor rather than a mask, because it gives that full face protection then.
And again, there are lots of people manufacturing these full face visors, and also 3D printing companies who are just switching the 3D printing machines on to making those visors.
And the screens as well, and we can send that brochure out, can't we, for the screens and visors. There is a company that in Wetherby that's doing them.
Yeah.
So, but there's a lot of people setting up now doing them, so they're not hard to find. Things like that. Masks are, I think they're on short supply, because obviously they want them to go to the NHS first anyway. So any suppliers that there are obviously go to the frontline workers anyway, predominantly. And
the face fitted masks as well, speaking from personal experience, if you've got a beard, then it don't particularly fit your face and seal.
No, if you've got to be clean shaven to get the seal. So yeah.
So we'll talk to Kat later about whether you can enforce somebody coming in clean shaven so that their mask will fit. So
there is an exemption for Sikhs though in the HSE legislation, and masks for religious reasons,
Right.
So
Pete, do me a favour, just have one on, I can't hear. Yeah.
Yeah. So PPE if you can't use the physical controls.
Okay, next slide. Okay, so hygiene. This is the main thing that we need to control coronavirus, as well as a 2-metre separation. So we need to do daily cleaning of all traffic areas that are high pedestrian routes. So your door handles coming in, any keypads, that's a lot of people have been forgetting the keypads on the gates, or alarm code, alarm pads. So handrails, toilets, canteens, kitchen, anything that people touch regularly must be cleaned down daily. So that's even things like forklift trucks as well. Vans, if you're sharing vans or forklifts, they need to be wiped down in between the users so that you're not contaminating between people. So hand gel is a good thing to have on workstations if we can source it. At the beginning of the corona outbreak, it was a bit like gold dust, but I think supplies are good now. There's lots of companies set up, lots of distilleries and brewers that have set up and manufacturing it, and other companies. So it is easy to get now, I think. We need to be mindful that antibacterial sprays, a lot of my clients have gone in and looked around and I think they're doing everything lovely because they've got some antibacterial spray. So antibacterial are not antiviral. So antibacterial spray is ineffective against coronavirus unless the formulation states it is effective on viruses as well. So there's only one that I've seen so far, one Dettol one, that actually does say effective against viruses. But again, I'm not sure that the checks will have been done against corona. Mike, you've got a contact that's actually making something that has been approved, hasn't it? And
I've sent the details through to you this morning because we got the other group who sent them out to. One of our clients is actually, their formulation has been tested by an independent test body, Huddersfield University and another place, that has been effective against all coronaviruses, amongst other things. And there's a British standard 14,000 whatever that it's been tested and approved to. Understand they are, if not the first, but one of the first that have definitely got that seal of approval, certificate from the independent test house against this ISO standard for all coronaviruses, dated the 5th of May. So it's as recent as that these things are coming out. But if anybody wants any details of that, we can send you details of that and the screens and everything at the end of the webinar.
Okay, yeah. So the best thing to clean and kill the virus is soap or any household detergent such as Fairy Liquid. They are the best things because they will break, the virus has a fatty membrane on the outside, and these products actually break down that fat on the membrane and kill it. So they're as good as anything. If you can't get hand gel, don't worry, soap and water is just as good. You can also use a bleach solution, 10 parts bleach to 9 parts water for cleaning down as well. But obviously I don't recommend that we use reusable cloth. The best thing is to use a disposable cloth or some blue roll or something like that when you're cleaning down, and wear gloves obviously when you're cleaning down, and then just throw them all away at the end of the day.
The other thing, just coming back at something that you just said there, Sarah, this product that has literally just been developed and tested, it is effective and proved and certified to be effective for 7 days on surfaces. So it kills germs on surfaces.
Surfaces for 7 days.
Not that sort of, I'd still say, what you said about cleaning it down every day, but this virucidal sanitizer sort of protects or claims to protect and is tested to protect services for 7 days.
So if you used it daily, you definitely won't get anything on them, would
That's
you?
what
If you're building it up and curtain it up, it would be, Okay.
Right.
Yeah, fine. Okay, so the other thing, obviously, we don't want towels, like normal household towels in the toilet that people are sharing. So it should be paper towels, really, if preferably, or if you've got hand dryers. No tea towels. That's what I've also come across in kitchen areas, is people are using kitchen tea towels. Obviously, they need to be not disposed of, but not used during this outbreak. So what we want people to do is wash their hands as they enter the workplace, wash before they eat, and wash prior to going home. So that's either washing or using hand gel. And then if we want to wear gloves as well, if possible, and they don't create a more significant safety risk. Okay. So obviously, if we are wearing gloves, they need to be disposed of in the workplace. So we need to look at staggering breaks as well. So in the canteen areas, we need to have the 2 meters. So look at your layout of your canteen, the tables, the chairs, and look at how many people you can get in that area. What one client did as well, and what the HSE guidance recommends, is to take any additional chairs away, so it does prevent that congregation. So if there's only 2 people allowed in a canteen, if you've got somewhere to put the other chairs, just leave 2 chairs in there at the tables at the distance where they should be. It just prevents people coming in and sitting down and having a chat. Toilet areas we need to look at again, so that we can maintain the 2 meters. So most of my clients, I've had to say just 1 person in the toilet area at a time, because the doors coming in and out, are at a point where people are going to get close to each other, and obviously there's not normally enough space for people to hang about and wait. So yeah, you need to look at your toilet facilities and to see how many people you can get in those.
Can I just interject there? Because Lindsay's been on for a while now, she weren't in at the beginning, but I'll just bring Lindsay in if I can, and just see if there's any questions that Lindsay particularly wants to ask. I'm just trying to, just unmuted Lindsay. So I don't know if there's anything you want to ask at that point, Lindsay, in terms of facilities.
No, I don't think so. Hi guys, anyway.
Hi.
I
mean, obviously, I think everything that you've been saying so far is everything that we've been sort of putting in the risk assessment. Certainly, the toilet facilities. We kind of thought, right, okay, with the gents' urinals, for example, do we close them off completely or just allow 1 in there?
Yeah.
We've got the cubicles already. No disrespect to men, obviously, but we thought maybe 1 urinal might be better to keep than having just the cubicles. But other than that, kitchen facilities, again, recommending only 1 person. I'm sure you could probably get 2 in, but we are recommending, and we're going to put signage up to say just at any one time if possible.
Yeah, and then obviously wiping down the kettle in between people, just the handle and stuff, because obviously in a kitchen, in a workplace, you know, 20 people might touch the kettle during the day. So if people just wipe down after themselves, if you've got some spray or some fairy liquid and just wipe it all down after each person, and that's the habit that they've got to get into.
It is, isn't it? It's educating everybody, really, because obviously we won't know who's using the facilities to be able to go in there. We could do it periodically, but we've got responsibility to be on the tenant or the individual using it, so they get used to processes that are now in place. So so far so good. I mean, the interesting thing is about the antibacterial. And obviously we've got antibacterial wipes that we've been using prior to lockdown, but you know, they're just Wilco's own, to be honest. So if they're not, there probably won't be virus. You know,
just check on them. They might do. The Dettol spray is one of the Dettol sprays is. So just check.
I will do.
Yeah, just have a read on it and check. So, yeah.
So my neighbour, interesting point.
My neighbour, she's a bit paranoid, and she keeps asking me to buy her antibacterial things every week, and I think I haven't got the heart to tell her that they don't work because she feels so safe with it. And I said to my husband, I just won't tell her because she just, you know,
it's making her feel safe and comfortable.
Yeah, it's making her feel safe. So I felt bad.
And there's a lot. Yeah, there's a lot to be said for that, isn't there?
There is, yeah. It's like the mask situation. A lot of the reasons people, you know, and why the government have recommended people to wear masks outside is really for their own, so that they feel safer. It's not really helping.
It doesn't do anything,
no,
unless you, like you say, the full visor.
Especially the homemade masks that you see, you know, that they've got massive gaps in the, all they will do is if you cough and you've got a mask on, it will stop some virus spreading out, but not all of it, you know. So they have a limited value, really. So
I did order a box of 50 masks for the cleaners, not because they're going to do anything, but only because if the cleaners feel comfortable or wearing them, then I'll have those to hand, but I won't be giving them out unless obviously they want them. But we've got the gloves, and obviously, you know, the tabards and the necessary sort of cleaning products to be able to resume cleaning.
Yeah, and that's all you can, you know, for cleaners, you know, that's it. It's mainly the gloves and then their own hygiene afterwards, washing the, you know, and not touching the face. That's the other thing with gloves as well. People feel that once they've got a pair of gloves on, they're safe. But then they start touching the face, and obviously that's what we want to avoid. Because I went to a client yesterday, and it's a garage, motor vehicle garage, and the bloke came in and he got grease all over his face. I said, "You see, he's been touching his face with his gloves on." So you know, people
you do it. You just do it automatically, don't you?
Yeah. Well, at the beginning of this outbreak, I thought, well, I don't touch my face.
Yeah.
But actually, you do, and you touch your face a lot of times. So it's a conscious thing to not touch your face. So that's changing in your own habits to not touch your face as much, especially when you're in the work. Obviously, when you're at home and you clean and everything, that's fine. But when you're out and about, trying to remember not to touch your face, it's quite hard.
Another question there, Lindsay, just on the toilets. As more and more people come back into BBIC, I think at the moment, is there only one toilet block that's open in there, and there's one to open the others?
That's correct, Mike. Yeah. So at the moment, there's just one set of toilets, so one set of gents, one set of ladies, and they're disabled. That's at the front of building 1, for example. Now, in the other 2 buildings, there's just the one disabled toilet open. But from the 1st of June, we're looking to open more. I mean, we'll have to open them all in building 2 and 3 on the premise that there's going to be more tenants on site, albeit I don't know how many there will be, because a lot of people are just still sticking to the government guidelines and saying, well, we'll work from home until we're told otherwise. But we will be opening those toilets up more as we see more footfall, and that's predominantly going to be around the 1st of June when we call more cleaners in and more staff in.
Yeah, I mean that one of the reasons why we ran, you know, this session now, so that as people were coming back to work, hopefully, you know, they had this experience before coming back rather than
That's it.
after coming back. And another one, just a personal one for our office. We've got a good excuse now for just leaving it to Diane to make the tea. So she's the only one who touches the kettle. So
Oh yeah, she'll be loving life.
Yeah, thanks for that. I'll got the excuse there.
She did say that she'd made Dam a cuppa other day, but she said that she wasn't willing to touch it, so we had to come and get it himself.
Yeah.
So yeah, it was quite funny. But
And trying
yeah,
to people, I don't know what. I can't remember it being, but I presume every office has their own cups and stuff. They're not shared.
They
cups,
do.
Are they?
Yeah, no,
so
not at all.
Yeah, so that's another thing that
Yeah.
And tell people to try and stick to their own cups as well. Like during the day at work, sometimes you can have 5 different mugs, can't you? And then they're all washed normally, and you can have 5 different ones the next day.
Yeah.
But if you can try and stick to the same mug and make sure you wash it out, then you know that your mug's clean.
Yeah, absolutely.
So like when I'm going to visit clients now, I'm not having a coffee. So because I'm trying to, as a health and safety person, I'm assessing my risk. So I'm going in, I've got my gloves on, sometimes I've got hand gel, and I'm not having drinks outside the house. So, I'm looking at my risk and managing it. So
of course.
Just looking
and
at
that's the
things
thing,
like
isn't it? There's got to be that responsibility on the individual to be able to look after themselves, but also as an employer, we are saying to tenant companies, you are responsible for your own employees.
Yeah.
You will need to provide the necessary PPE while you're in the unit, but also the communal areas will be managed and maintained by us. The for us, and I'm sure everybody is the same, is everything is on back order. We've got some dispensers that we're wanting to put up in the communal areas, predominantly near the touch points where the car parking touch pads are.
Yeah.
And, we've got the dispensers, we've had those for weeks, but trying to get the antibac to go in them is an absolute nightmare.
Oh, we can get you some, can't we, Mike? That yeah. There's a company down the road, they're making it now.
Yeah.
Right. So if you could send me some links. I mean, obviously there's a certain sort of refill that needs to go in the dispenser.
Right. Oh, is it a special one? Right.
But
okay,
going forward, in terms of refilling that dispenser, or even just the small bottles that we're providing to the cleaners, the 5 ml ones, or even any ones that we're hoping to get, then that'd be perfect.
I'll send you the details, because what this company are doing, making it in a super concentrated form, and then they can post that out couriers, and then it dilutes on site to, I think it's about 40 or 50 times the volume. And
brilliant!
Then you use that. So I'll send you the details of them, Lindsay.
That'd be great.
So you've got that.
Yeah. We can get, there's lots of companies setting up and manufacturing that now, but obviously if it depends, obviously like your dispensers, it depends, doesn't it, on what you've got.
Yeah, absolutely, because she did try to sell me something else, but I said it doesn't go in the actual dispenser itself.
Yeah.
So,
I think I've found that a lot of clients have had trouble because they wanted to get dispensers, and obviously they're like gold dust, and they're tying people into 3-year contracts and things like that, and getting expensive, and it's just good. It's good to have them in the pump, on the table. Obviously, some situations that won't be appropriate for you, like at the car to get, so, but obviously just think, outside the box and just think, do we need these dispensers? Can we just use the other ones as well? So, yeah.
I think the thing is, we can use freestanding ones on receptions, but unfortunately we've been putting them in the kitchens and the toilets, and they've been going.
Have they? Yeah.
So we have to be mindful that we want to make sure that all our tenants are provided with the facilities and the cleaning materials that they can be, without somebody unfortunately
pinching it. And why do people pinch things? I don't know.
Especially in this sort of situation where we're all so conscious. Why would you do that? But unfortunately we do find that. So freestanding ones just aren't suitable for us, because they just get taken straight away, and obviously we're in short supply.
Yeah.
Thanks for that, Lindsay.
No problem.
Just move back if I can, because there's a question about vans. If 2 people need to travel in a van, how can it be safely done, if at all? Would it be effective to make a fitted screening, clear, unbreakable polycarbonate between them?
Right, so travelling vehicles, obviously, traveling with other people, we need to try and reduce as much as possible. But obviously we can still do it, and they have produced guidance on it. So you need to have a dedicated, so instead of swapping who you're traveling together with, you need to be traveling with the same set of people. Yeah. So, and then try and mitigate the risk by looking at if it's a minibus. So recently I did one where the minibus seated 11, and we decided and thought, right, we can get 7 in, with spaces in between. They haven't recommended any kind of, the HSE haven't, any kind of PPE that you would need or screens in the vehicles. They've just recommended that you have the windows open. Obviously screens would be good to prevent the virus, but then you would have to think about, does it affect health and safety while you're driving in any other way, or if you had an accident, is it secured, etc. So your main risk is travelling bans or vehicles is try and reduce the number of people, then look at your spacing, and then ventilation.
And was that for the one that was going down to France as well?
Yeah.
So even distances like that.
Yeah. So I mean, what we did there is we got the visors as well. So so we said to them that we would like them to wear the visors, but they're not going to sit all the way from Leeds to Lyon with a visor on either.
No.
Realistically, but we've provided it, and yeah.
Got another question. With just 3 toilets, understood correctly that after any external person using the facility that the toilet needs to be cleaned. We do not have a full-time cleaner. How should this be managed?
You just clean it yourself. Yeah. There's no need for any of the cleaning requirements that are the daily cleaning of the door handles, etc. It does not have to be done by a cleaning company. You can do it yourself as long as you're wearing your gloves and you're using the disposable cloths, and you just throw it all away at the end of the cleaning, and then hand gel your hands or wash your hands.
So somebody's got to do it. I don't know whether do you want to come in on that, Zoe, and ask the question. I'm trying to unmute you. Yeah, if you want to ask the supplementary on that, Zoe, I've opened your microphone. No, but I mean, I'd just make the point that you clean it yourself. Somebody in the organisation's got to be responsible for that, because does that mean every person going in has got to clean the toilet themselves, or?
No, just after external people, and then you're cleaning the toilet down daily at the end of the day.
Right. So it's not.
So your toilets are part of your daily clean, and your canteen and your kitchen areas and your door handles. But if we've had an external person use those facilities, then there is a risk of them bringing something into that area. So therefore, you would clean it after they've used it.
So it's only after an external person.
External person, not after every person.
Yeah. But I'll come back to Lindsay on that then, if Lindsay's still there. How does that affect with BB? Because if we're all from different organisations, are we all classed as internal or external? I'll just unmute Lindsay on that one in just a minute. It's always unmute straight away. I'm just trying. There we go.
Sorry.
That's unmuted.
There. See, I would say for BB that all the tenants are the normal users of the toilet. So it's only if you had a visitor or a delivery driver coming, if you like DPD man Ken said.
The delivery drivers, they do tend to use the toilets.
So you could have Royal Mail. So you could have a designated toilet for them, couldn't you? One of your disabled toilets. I'm just trying to think where your toilets are, or one of your cubic, one of the floors. Right, that's for the visiting drivers, and then you're not having to clean it before your tenants use it, and it could just get cleaned at the end of the day. Then
I think the only thing that we could do, because obviously delivery drivers are not open to any other toilets other than the ones that are just off reception. So could possibly do is say that the disabled one is just for delivery drivers only. But obviously you do get a disabled tenant. I mean, I'm not aware of any disabled tenants, and most of the tenants are saying that they're not accepting visitors, so we shouldn't really have that issue there, but we can just designate that for
temporarily.
That's
That's the best idea, and then you're just cleaning it at the end of the day.
That's it.
Yeah, and then they have to take their responsibility for their own hygiene when they've used it. You know, they should have hand gel, etc., provided by DPD or whoever, to maintain their safety while they're out and about.
Yeah, I mean, there's soap dispensers in the toilet as well, isn't there? So they can it's just more
wash the hands. It's then just touching the door handles and stuff, which you know they at the moment they're not signing for deliveries, are you, or anything like that? So
that's right.
You know, there's less contact and less risk there. So
that's it.
It's just what I will say about this is it's not black and white, and we'll never have a COVID. I know Boris talked about COVID secure. We won't be COVID secure. We'll be COVID managed, really. So we'll never reduce the risk to zero. What I'm saying, it's like everything. Have we done everything that is reasonably practical for us to do as a building or a business or a company to manage the risk so that it's safe as possible for people to come? If you don't want to be exposed to COVID, you're going to have to sit in your house for 2-3 until a vaccine comes, So that's the only way you could theoretically be not exposed. But then you want food, don't you? So your food comes in. So nobody could be COVID secure fully, even if you don't go out your house.
I think that's it, isn't it? Because a lot of people, I think, no matter, in some respects, no matter what we put in place, there's potentially always going to be somebody that doesn't think it's enough, or that, we do something else. And I think it's a bit of a minefield there, but all we can do is do our best in line with what's available and what we know, and the guidelines. And that's what they're doing. Yeah.
And that's all that you can do as a business. And that's what we need to do as businesses going forward, because we want people to be back in work. We want the economy going, businesses need to be going. So it's how we manage it, isn't it? And yes, obviously there will still be a risk, but the risk is minimalised. And if you follow this, then the risk of getting COVID while in this workplace is minimal.
Yeah.
Another question on this sort of point: if you've got lots of external deliveries, cleaning the toilet in this way is not manageable, what about making the external person responsible?
So they're not going to have any cleaning stuff with them, are they? So that's not going to work. But like we said, if we just have one toilet that they use, so like say it like Bush, we had 3 toilets in a porter cabin. We made one for employees and one for the drivers within it, so you can leave that one till the end of the day and it just gets cleaned daily.
So you don't have to clean it after each external person has been
No,
right.
Just
I
mean, obviously ideally that would be great, but it ain't going to be practical, is it, to clean it after every delivery driver? So if you make it an assigned toilet and then we clean it at the end of the day, that's
and you can provide the cleaning materials in the toilet. Right. Hopefully that answers that point. So if everybody's okay on that, no more points on that, what I'll do, I'll move on to the next point with Sarah.
Okay, so home working, obviously a lot of people have been doing this already. So as an employer, we have the same legal duty for home workers as we do for people working on site. So we do need to undertake risk assessments. I have got a home workers checklist that we can share with you. So we don't have to go visit the houses, obviously, but they need to just complete a checklist to make sure that things are as safe as possible. Obviously, from a health and safety point of view and a HR point of view, we can't talk about this. We do need to keep in touch with home workers. They can feel very isolated when they're working at home. We do need to make sure that they are kept in the loop. Now, normally, if somebody was a home worker and that was a permanent part of their role, we would be expected to provide such things as desks, adjustable chairs, etc., for them working. Now, with this being a very transient nature working from home at the moment, the HSC wouldn't expect you to go out and spend money on such equipment. So it's a matter of making best do, really. So perhaps there's some things that you've got in the office that you could bring, that they could take home, such as the chair, etc., so that they've got an adjustable chair at least. But I wouldn't worry too much about it, because obviously it is hopefully only transient. But if after all of this, a lot of companies may decide that home working is good for some businesses, and so some people may decide to be permanent home workers, and in that case then you would have to go out and buy them the correct equipment.
Yeah, may not be good for VBIC.
No, they need people in the offices, don't you?
We do. I mean, that's the thing. We've already had one tenant actually say that working from home is enough for them, and they have provided notice. So, but we think it could go one or two ways, to be honest. People might just be sick of working from home when it goes back.
You see, it's socially isolating working from home. So, you know, you don't get the office banter, you don't get that interaction with people.
That's it.
You know, some people, I mean, I've done it on and off for years and years and years, but I remember when I first did it, I thought, I could have died and nobody would know. Nobody rang me for like 2 weeks from this company, honestly. It was bizarre. Yeah, and it was just, so it does take a lot of getting used to, and it's not for everyone. So, you know, some people will be desperate to get back in the office.
Yeah. We've heard a few stories already on that. So trying to stay positive in this sort of challenging environment that we're in at the moment.
It is. It's difficult for everybody, isn't it? And everybody's having to work under different circumstances, and nothing feels the same, does it? You know,
no,
nothing feels quite right, does it? You know, so it's hard, isn't it? And we just have to be mindful of that, don't we, for people, really?
Absolutely.
So so other things we need to consider are receipt of parcels, which and things like that, and delivery notes, touchy things like that. Obviously, a lot of your couriers, your DPDs and your parcel for whatever now, they're not actually asking you to sign for anything anyway. So we're not actually having to touch anything. There's no evidence that the virus lives on any kind of, you know, like your cardboard or your post or anything like that. So you should, you know, we're okay to touch those kind of things. But it's obviously just signing for things. And obviously we do need a procedure for what to do if someone suddenly starts to feel ill whilst they're at work. What do we do? Obviously, hopefully send them home, but if they don't drive or they need someone to come and pick them up, it's about where we put them and what we do in that situation. So I had a client this week who they sell parts for tractors and stuff, and a man had come in to buy a part for the tractor, and he's chatting away to the man behind us. He said, "Oh, I've had a bit of a crap week this week. I got diagnosed with COVID," and he stood there in front of everybody. And so, you know, people don't always follow the logic. So obviously they had to ask him to leave and wipe everything down after he'd left. So there are always exceptions to situations that you haven't come across, really. So, because we've not covered that, somebody coming in and going, "Oh, I've got COVID," as part of the risk assessment, because we wouldn't think that anybody who knew they got COVID would actually go near anybody else, but clearly they do. So so it's having procedures in place for these situations occurring.
What about checking temperatures on arrival?
So again, just because you've got a high temperature doesn't mean you've got COVID, and just because you haven't got a high temperature doesn't mean you haven't got COVID either. So they're very limited use, really. So I wouldn't recommend that anybody went out and bought a thermometer and did it, because it just doesn't prove anything. And what you're going to do, say to somebody, "Well, you've got a high temperature, so you've got to go home," and do you pay them, don't you? It's until they're actually diagnosed with COVID, I would suggest that you don't bother.
Okay, I think that answers that one. So I think you covered the next one as well. So clear guidance given if sent home. So need a procedure for what to do when someone has symptoms, and so have it all thought out, and what your policy is going to be, and stick to it.
Yeah.
Okay. So has anybody got any more health and safety related issues or questions they want to raise. I've got one which was again sent in earlier. I just can't lay my hands on the piece of paper. I've got that many of them in front of me. Here we go. Jamie, do you want to come in and ask your question yourself at that point? I think I've just unmuted Jamie and then he's, yeah.
Can you hear me?
Yeah, can hear you now.
Yeah,
Sorry,
we
I
can
think
hear
I
you, yeah.
unmuted you and you unmuted yourself.
I do a lot of site visits related to IT, so it's a lot of hands-on stuff.
Yeah.
Been undertaking quite a bit of work last week or so. Now, I visited one customer who were really good, and they're actually doing what you said there, checking temperature and entry and stuff, which set a really good example, I thought.
Yeah.
That it didn't really do much use, but they're all set up, they're all geared up for this. Went to another customer after, and they've no interest in it whatsoever. All they want to tell me where it's been tested by Chinese. They don't believe in it, and they're not really doing anything at their place. And I felt really uncomfortable doing business there. But obviously, you know, I need to do the job. So I'm thinking I need to take some checklists with me. You know, do I get them to sign something to say that, you know, they've done this to allow me? You know, I guess it's the reverse of, you know, me going into business. I'm under their conditions, really, aren't I?
Yeah, I mean, what I would do is, if you're going in, is asking for their COVID risk assessment to see if what they are doing. A lot of the COVID risk assessments are on the websites as well. And then, you know, if that was me, I'd be saying, right, so if you go into that company that hasn't really done anything, you know, you have to then manage your risk yourself.
Exactly,
so it's like wearing gloves and having your hand gel and stuff. So, and then washing your hands. If that was me, and they probably can't, you know, they probably won't wipe the doors down for you or wipe the area down, would they?
No.
So you just got to make sure, right, I'm going to go in, I'm going to do this job. I'm going to go straight in that room where the IT equipment is and do my job and come out. I'm not going to have a cup of tea. I'm going to wear my gloves. I'm not going to be near anybody. If anybody comes near me, I'm going to ask them to move away. And that's literally all you can do, and come away and put hand gel on and wash your hands, and, you know, that's all you can do.
Set my own guidelines and live by them rules.
Yeah, you have to. It's like, you know, if you want the business,
I know it's I don't really want to go in there, but on the other hand, you know, I need to. So
yeah, I mean, you know, commercially, could you say no? I'm not coming in. I don't, you know, it's your commercial relationship, isn't it? But if you've got to go in, and it's, you know, then you have to. If they're not going to manage the risk, you have to manage it. Yeah.
No,
and it's like when I go to the supermarket now, when I come back, I just put my clothes in the washer and I go straight in the shower. So, you know, just things like that. When you come home, have a shower, put your clothes in the washer, and and manage it as much as, and just tell people to stay away. It's like last week I went out and did a risk assessment, and we started off 2 meters apart, and then because we were chatting and we know each other, they got closer and closer, and I went, hey, you've come too close. So it's just, you know, because people do forget as well, it's a whole change of culture and behaviour for us all. You know, so people will come too close because they do forget as well. Not just because they don't care, but they forgot.
They forgot,
so, yeah. So you just.
Thank you very much, Kat. Much appreciated. I will, I'll do your own guidelines, you know, checklist.
Yeah, and just say, obviously, you know, perhaps your own guidelines would say to the customer, and, you know, clean the area, you know, those good customers to clean the area for you, have it free of people. I don't want anybody within the area, you know, I want to come in, you know, so just put those down as your guidelines.
Yeah. And thanks for that, Sarah. And I was just going to ask Amanda, and she stuck her hand up anyway, because I know you've got a similar situation. You're going to go into places. I know, Andy, you know, you're going into other people's workplaces. So, Amanda, you've got your hand up. You're going to ask a question.
Yeah, just Sarah, we go into people's houses, so
Right.
we install blinds. So I have wrote some guidelines that we will be sharing with customers what to expect.
Yeah.
And I think it's a lot about communication. So when we've agreed as installation date, they'll get a set of guidelines, and then I'm proposing on the day or the afternoon before the install that we actually do an over the phone risk assessment with them. So again, really clear, because we want to protect them and our people as well. So
I wouldn't have to, like normally, like if I had somebody in my house doing that, I'd be chatting to them and, oh, would you like a coffee? But
I've got that.
So obviously not to have a coffee, and obviously to ask the resident of the property not to be in the same room while you're working.
Got that.
And doors to be open, not doors not to be shut. So that's what, like for estate agents, I've got an estate agency client, and what we've said for viewings and stuff is all doors are to be open, so you're not touching anything. So for when they go in, if they just ring the doorbell and literally walk into the room and clean the area down that they're using, and then put the blind in, and they've got the gloves on or the hand gel to use in between. Probably can't put the blind up with gloves on, can they? So if they use hand gel, and then they're managing that risk, and the resident of the house isn't there breathing on you.
And the thing we've done for the visibility bit that you said, we've got some Ivy's jackets on order saying please keep 2 meters away from me.
Oh, good idea. Brilliant.
Because it is easy to forget.
It is, and it's like me the other week. Honestly, I wasn't until I realised we'd been talking for a while, and I went, "You've actually come too close. Move away." But it is, because when you're talking to people, 2 meters is quite a significant distance.
It feels strange, doesn't it?
It feels alien. It's like when I went to a new client the other week, I said, I won't be shaking your hand. And you feel rude, don't you? But people understand because we're all getting used to it. So, it's just a matter of changing your mindset, really, isn't it?
And just on a similar vein, I don't know if you got anything, Andy, whether you want to add anything on that side of things.
We've been working throughout, because we've got customers that are working throughout steel industry, construction sites. They're all different. So I found you've got to be open-minded, and you've got to look after yourself. All you can do is put in place safe working guidelines, use your common sense, give your staff rubber gloves, give them a mask, give them some goggles. You can't make them wear it because you're not with them. It's like having kids. You can tell them what to do, but you can't make them do it. The organisations that we've been involved with during this period have been quite sensible. So take Price Check, for instance. They turn over 100 million. They distribute goods and toiletries to bargain supermarkets. We deliver our kit to outside their door. We go, they come, they take it and put it in place. My service engineers will only go into a business if it's safe and if they feel safe. And what we've found is there's no pressure or no bad feeling if an engineer says, I can't come in there at the moment, because our customers tend to then go that extra yard to make it comfortable for our service guys. So that's all you can do. You can just be sensible. Wash your hands, wash your hands, wash your hands.
It's all about washing your hands,
Just wash your hands.
But you see, a lot of your workers and your shop floor workers don't really wash their hands, do they? A lot of the time, they go to work in the morning and they won't wash their hands till they've got home on a night, and it's changing that mindset of people, isn't it? Which takes time.
We don't deal with shop floor people. They're on shop floor. We're putting systems in offices, so we don't come across the shop floor. So, I mean, my youngest lad's worked all through in steelworks, and he's CNC mechanical engineering, and I presume he's got gloves on, and I presume they give him guidelines to follow. But,
Okay. Thanks for that, Andy. One more question that's come in. Do you recommend one-way walkways in offices? Our corridors are not 2 meters wide.
If you can, one way is brilliant. So client the other day, we'd put a one-way system in and we got the 2 meters marked out on the floor and everything, but it depends on the layout of your building as to whether you can do that and how it works in each individual situation. But if you can put a one-way walkway in, that's absolutely fantastic.
If not, would you think something like traffic lights, or so that it's one way, intermittent?
I think for the amount of time, one of the public health guidances says that you can be closer than 2 meters for up to 15 minutes. So if you're just passing in a corridor, the risk is very low.
Yeah, what we're going to do with our corridors is we're going to ask people just to keep left. So if they're going down the corridor, the signs to say keep left, and then if they're coming up the corridor, it'll say keep left. So it just means that they will keep left. So
and you can, you could turn your face the other way when you come to somebody, so that you're not face to face. You could actually just turn if you actually wanted and you felt so anxious about it. If somebody's coming towards you, if you just turn your head so that you're not face to face with somebody. So,
that's it. Again, it's up to the individual, isn't it? As it's they're working
out. You see, it wouldn't bother me as long as I, if nobody coughs on me or spits on me as I walk past them, then the risk is minimal. Is minimal. So it wouldn't bother me. But other people would be really anxious about that. I've had people when I've been out walking in the woods at home that have gone absolutely miles round me, because they're anxious, and I get that. So everybody is different, aren't they? And it's how
it is. Very different degrees.
Yeah, everybody perceives the risk differently, but the risk is actually very, very low in that situation.
Yeah.
Okay.
Yeah.
So I'm just conscious of the fact that we're moving on to the kind of HR side of things now. So if there aren't any more health and safety related issues, which it doesn't look like there aren't, seem to be any more coming through, what I'll do, I'll move on to the second part. And I know a lot of things we've covered already, and bring in Kat if I can. And thanks for response from Sarah so far.
Oh, you're welcome.
Thanks, Sarah, and bring in Kat, who's our HR specialist consultant. And Kat's going to take you through one or two of the HR implications of COVID. So I'll hand you over to Kat.
Thank you. So mine is, you may or may not be glad to know, the shortest section of the two today. We're primarily focusing on the health and safety, but some of this stuff nicely interlinks into what Sarah's been talking about. So first and foremost, I guess one of the really important things throughout all of this is thinking about communicating with your teams, whether that's communicating with them on a return to work, whether that's communicating with them while they're at home. Sarah touched on earlier about the importance of not being out of sight and out of mind, and communicating with people who might be off on furlough leave. Whatever the circumstances, communication is always king, but I think in this uncertain time where everyone is unsure, it's more important than ever. So thinking specifically about communicating from a coming back to work perspective, I think first and foremost, one of the really important conversations that you'll be having with people if they've been away from work is when you want them to come back, but in a personable way. And what I mean by that is I would always recommend that people are having conversations by phone or a Zoom or whatever way there can be a two-way conversation to discuss any issues people might have or any concerns they might have about coming back, rather than just popping them out a letter that says on such and such date, we're expecting you back at work, we'll see you then. Don't get me wrong, the letter needs to happen because effectively you have changed someone's terms and conditions of employment by placing them on furlough leave, for example, and you would also then need to write to them again to confirm that that is being undone for them to return to work on their normal terms and conditions. But I'm sure a lot of this is common sense, but just making sure we're having those interactive conversations first before doing the paperwork. What I would say is in terms of record keeping, when you are having these communications going in and out about furlough leave, back off furlough leave, bearing in mind that you do need to keep those letters on file for 5 years from a GDPR perspective. So staff files will need to retain that information for 5 years. You could also potentially be asked to produce it as well on the back of claiming the job retention scheme payments. If you've been claiming furlough monies, you could be asked to show some of that paperwork potentially around that too. But like we touched on earlier on the back of one of the questions that came up during Sarah's section, if you do need to have people go on and off furlough leave, obviously you can, but bearing in mind 3-week blocks is where you need to be able to continue to claim your 80% payments back. So thinking a bit about practicalities then when it comes to speaking to your people. So it's fair to say, isn't it, we as business owners have been through a lot, your employees have been through a lot, it's been a very strange time, and chances are people are going to be looking to you as their manager or business owner to support them. So it's fair to say that there's potentially quite a lot of things that people might have experienced during this time, whether it's around their own physical or mental health on the back of lockdown and all this bizarre thing that we've had to adapt to. It could be financial issues, bearing in mind lots of people have had reductions in their income, either personally or in their household. Unfortunately, there will be potentially people who work for you who may have lost people as a result of coronavirus or for other reasons during this time where they've not been able to do the things they normally do. So just thinking about all those potentials really and what you can do to support. So if you are an organisation that's got access to things like an employee assistance programme, use those, make sure people know they're there. But similarly, when you're having good quality conversations as people return, hopefully in a one-to-one setting, just by conversations that you'll be having and the fact you know your people, hopefully you will get under the skin of any of these issues that people may have, and you can signpost them towards the appropriate help and support where it's needed. Also thinking about challenges preventing return to work. So when we talked about conversations to discuss with people the return to work, it may be that there are anxieties that people have about coming back. It might just be the amount of time they've been away from the workplace. More likely, it's possible that there'll be issues where people have got concerns about what is being done around safety to be sure that they are okay to come back to work in their own minds. And I guess it's just being geared up in your own mind to be clear on what you're going to tell them about that to reassure them.
I've got a couple of questions there, Kat, which are both very similar. So, one is some are wanting to delay returning even though employers want them back in. Can I come back in next week? And they don't have childcare or legitimate reason, just asking to not come in yet. And then another one where employees are being reluctant to return to work, saying they're not convinced it's safe. Employers feeling they're almost pleading with employees to come back. If some do come back and others say they're not, where do we stand? Presumably, if they're not isolating, shielding ill, they have no legitimate reason and should be in work contractually. Therefore, if they're not, presumably it's unpaid leave or holiday. Yet the government is saying, speak to your employer, it's not fair on those who do come in if others don't. So there's two questions there, and one where it's almost like 5 o'clock, we try and get as many questions in one as they can.
No, that's fair
enough. You get the gist of what people were just trying to say there.
Yeah, definitely. And I think certainly the bit we're about to come on to next about use your internal policies. I mean, the first bit of that is if people are on furlough and saying, oh, do you know what, I won't mind waiting a bit longer, no other reason, just quite enjoying my furlough leave, thanks very much, I'll take my 80% sit at home. If that scenario is cropping up, you're perfectly within your rights to say, well, actually, there is now a need for you to be back at work. So the decision to place someone or take someone back off furlough is primarily the employers. So if there is a need for them to return and there's no legitimate reason stopping them, they need to be coming back to work. If they don't come back, you might need to start thinking about things like using your policies such as your AWOL policy. People just decide to stop talking to you now because they don't want to come back. All of the things you would normally do if somebody's not coming back to work outside of COVID, you would still look at using those policies. Similarly, though, if you've got people who have got genuine concerns, for example, around safety, then again, I guess it's down to reassuring people about what is being done. So the important part is the questioning really of your people around what is it specifically that you're worried about from a safety point of view that's making you nervous about coming back. Get to the bottom of what that is, and then from the plans you've put in place in your workplace, you'll be able to hopefully reassure them. But the thing that I know quite often gets a reaction when I've spoken to some of my clients about this is that ultimately, you can't force someone to come back to work if they have a genuine belief that it's unsafe to return. And you do potentially open yourself up to claims for unfair dismissal on the grounds that people then resign and then put in a claim because they feel they've been forced into a workplace that's not safe. So you've always got to be mindful of that. But similarly, if it's around caring for children, which could still be happening at the minute while the kids are not back at school, it's looking at, you know, how you want to tackle those people. Some clients will leave them on furlough, but it might be that you want to use unpaid leave for dependents. They can't come to work because they've got children to care for. You might decide that in your business, your approach is that you actually give them time off for dependents, which is unpaid, but would be within your policies. So I guess the short answer is you would look at what the scenario is from your employee, what is the reason they can't return to work, and primarily you use your policies that you have in place in your business to address that problem.
In terms of those policies, another question that came up is because although people are still accruing holiday during the furlough period, they can take the holiday during the furlough period, can't they?
You can take them off furlough to use holiday, yes. So you wouldn't be on furlough and on holiday, you'd be one or the other. So you could in theory say, right, okay, like with the childcare scenario, you might say, right, you know, school, say it's decided school goes back on the 1st of June, say that's where we end up. You might decide, well, for that person who's struggling with childcare, rather than ask them to have unpaid leave, you ask them to take holiday. So they're still getting paid, they're using their holiday entitlement up, and it resolves their childcare issue. So you'd be using the policies that you've got to work to the right outcome that you want to achieve, basically.
Yeah, and then if they've not used their holiday entitlement, they will understand now it can be spread over a 2-year period.
Yep.
But you're still going to have potentially, you know, a big rush when we go back for people to start wanting to put their holiday entitlement in. So therefore, you know, is it still in management's prerogative to accept or reject
yes
requests?
Of course it is. So 2 things on that. Firstly, obviously a holiday request is what it says on the tin, it's a request. If you can accommodate the request, great, but if you can't, then you're perfectly within your rights to say, no, I'm sorry, I can't allow that time because we need you. But similarly, because of the fact that there has been this interruption in business this year, it is written into law that holidays can be carried over into 2 subsequent holiday years to stop that bottleneck at the end of the year where everyone's got most of the year's holiday entitlement left, all trying to get it in and potentially can't. Because in most cases, I'm sure in a lot of businesses, you will have a policy that says use your holiday or lose it. But for this scenario, it is written into law that you can carry over holiday into 2 subsequent holiday years for your basic entitlement. So by that I mean the statutory minimum, which is 20 days plus bank holidays, you can allow those to roll over.
Right. And again, saying you've got your internal policies to decide what's fair and what's not fair, and you know why one person might be granted the holiday and another person who's requesting the same period might be rejected.
Yeah, so with holidays, you would normally, most companies, most clients I work with, it would be on a first come, first served for holidays. So once you've filled that quota, you'd be perfectly fine to say, I'm sorry that we're fully booked for that time, or we can't accommodate that in terms of the business. It would be just as you would for any other time for holiday requests.
Yeah. I've got another question that's come in. This is the nub of the issue, though. Coming back to work is less safe than staying at home. Any concern on this front is reasonable, i.e. genuine. I think that until furlough is at a lesser rate, this will be the major challenge, won't it? How do we overcome this? Good question.
Yeah, and I think it goes back to what we were saying before around, you know, there will be people, probably there'll be 2 camps of people, won't there, that are currently furloughed. The ones chomping at the bit, wanting to get back to work because that's how they are. And then there'll be potentially other people who are quite enjoying this time off and still getting 80% of their pay. But in reality, this is a short-term solution. And furlough and 80% pay is not going to be around forever. We already know that. It is just about, I guess, ultimately, at the point where work is available to be done, furlough leave would then come to an end and people are expected back at work, and it's a case of dealing with each case on its own merits. I mean, certainly a lot of the work I do with my clients at the moment is around if they've got sticking points with people, talking them through what the solutions could be, because actually it is to a degree a negotiation between the two of you, but effectively, once there is a need for people to be back to work, there is an expectation that they do, unless there are certain very key specific problems that you then can work together to overcome.
And these are things that I'll move on to your next slide now, Kat, which is the consultation. But before bringing you in on consultation, I will say two things that I mentioned on Tuesday, and we're going to be covering in more detail, is the communication and leadership. And we've got separate sessions on those next Wednesday on communication with Stuart, and leadership I think is the week after with Stuart. So he's going to take you through how to lead people back and how to communicate and things like that. And just for because Kat's only had a small spot in today, we have got a post-COVID HR slot towards the end of these sessions as well. So you'll be seeing more of Kat as I think the HR issues will start becoming more of an issue as we get more people back. So this is just an introduction to what Kat's going to be talking about later on in a session later on in the program.
Can I just come in there, Mike? Yeah, like when you're doing the COVID risk assessments, we obviously need to involve employees in that, and they all need to receive a copy of it, so when they're probably coming back off furlough, when you write to them, perhaps you could send them the risk assessment and explain to them and ask them to comment on it, because there may be things that you've missed, or, nobody's perfect and you don't think about every situation. So, these risk assessments as well will be fluid, really, as guidance changes and as the COVID situation changes. So they're not set in stone. So, involve them in the process that you are looking at things and that you have addressed it, and ask them for their comments as well. So that is very, very key on the COVID risk assessment, about consultation and communication with employees.
Yeah. Oh,
absolutely.
Well,
yeah.
Okay. So the first thing to say about consultation really is that if things need to change when people are coming back to work and businesses are reopening, that would need to open a formal consultation. The key point here is that when people come back to work, they'll be entitled to return on the same terms and conditions of employment that they were on before the furlough leave. So, for example, if they were on full-time hours, they still be entitled to come back on full-time hours, etc., etc. So if that does need to change, then there are ways of doing that, but it would be a consultation process. Could you hit the button, Mike, please?
Yeah.
So, as we said, the default back to the same terms and conditions. So in terms of in consultation with people, if you need to make changes, I think it's fair to say, depending on the level of impact during COVID, it will depend. Some businesses may potentially be in that really great place where they are maybe growing their business and need to take in more people, but then there are going to be a proportion of other businesses that actually are in a position now where their order book shrank, or whatever the reason is, where they now don't need as many people and need to look at then reducing their salary spend. And all I really want to kind of highlight today on this slide really is that I think naturally when there's a need to downsize, the first place people tend to go to is, I need to make redundancies. Now, that may be something that you need to consider if you need to downsize, but that's not the only option. So just a couple of sort of food for thought things on this slide here. Some of these things are other potential ways that you can reduce your salary spend or the size of your workforce without needing to make redundancies. So, for example, you might be looking to bring people back to work on reduced hours and pay, so less hours for a prorated rate of their previous salary. You might be looking at potentially bringing people back on reduced pay, but for the same hours, again, all in consultation. And then there could be other things that, depending on your business and how you're expecting it to look when you're planning for the next, sort of 3, 6, 9 or 12 months, for example, it might be that you've got some really great people in your business with some really key skills that you don't want to lose. But it may be that they are people you might want to look at offering unpaid career breaks or sabbaticals to, if you've got people that potentially might be open to that. But then aside from your existing people, it could be that you were an employer that was in a position where you were in the process of recruiting at the time when COVID all hit. Therefore, you've got people who are due to start with you. So in that case, you might want to be thinking about deferring people's start dates for new employees, and potentially, depending on the situation, you might want to consider withdrawing job offers that you've already made. Now, all of this stuff is delicate. All of this stuff has to be handled through a process and done in the right way, but effectively are all options that you can look at if you do need to make changes. So just to preempt really a few thoughts on that, but the important thing to bear in mind is that it's really important that any of these changes that you might look to make, it's about making sure that it's a fair and consistent process that you go to, that people are correctly consulted with, just basically to keep any risk to a minimum as you go through these processes. I say to all my clients, you know, you can do anything that you want to do in terms of achieving an outcome. It's just about doing it in the right way, and these things are all very key examples of that.
And you know, each one's an individual circumstance. I mean, just for some case in points on a number of points that you've made there, Kat. My daughter-in-law, my other daughter-in-law, not Dom's wife, but both of them are on maternity leave at the moment. But my other daughter-in-law, their company will probably look to shrink at some point, certainly in the near future. She's quite happy and kind of, you know, suggesting to them that she'd be quite happy to take a, you know, 6 months unpaid sabbatical, you know, extension to her maternity leave, and then, you know, sort of go back in another 6 months' time, rather than going back in the summer when her actual maternity leave runs out. So that's one example that, you know, being involved, you know, in personally that I know of. And then we've got others where clients who we've got one operations director leaving, and he in theory left at the end of March, but what the company have done is actually kind of kept him on and furloughed him, which kind of helps him because he didn't have anywhere to go to. But that means that the offer of employment that they were going to make to somebody else has then been delayed. So it's got a knock-on chain all the way down. It's going to be like, you know, house buying chains. As soon as something moves, you know, there's going to be movement right through the market. But that's one where, you know, because one person were moving, that got deferred. So his existing company have done him a favour and sort of kept him but put him on furlough, so he's not actually doing it. But that means that they're not recruiting his replacement until all this solidifies. So there's lots of individual scenarios that are happening all through this, and you just got to be, you know, creative and you know, and think about ways that you can do things within the rules, but hopefully, you know, do the best by people that you can.
Exactly. Yeah, totally that. And I mean, looking at like the career breaks and sabbaticals, like you were talking about there, Mike. I mean, you know, one of a clients I've been working with that does engineering, they've got somebody there that, you know, is someone who's got a very specific skill set that they absolutely don't want to lose. This guy's been begging them for a career break because he wants to go off on a trip around the world, and they've not been letting him go because they've needed his skills. But now this bloke's happy as Larry because they've allowed him to have his career break and his sabbatical, but on the basis that he's actually coming back in 12 months' time and his job's going to be there for him. So it's good for the company and it's good for him.
Yeah. Can he travel yet? That's the only
yeah.
thing, though. He can't travel.
Exactly, but he's happy that he's going to take that year, and when he can travel, he will. But he's having the time off in between because that's exactly what he wanted to do. So, you know, it's worked for them both.
Okay, right. I'll move on.
Yeah. So, let's hope we can all travel again within the next year. You've got me feeling all depressed now, Mike. Thinking,
sorry about that. Yeah.
Playing for a year. Oh, yeah. Anyway, so getting employees settled back in then. So this touches into some of the things around when people are coming back to work and setting the scene, really. So thinking about some of these people who are coming back to work have probably been off for a very long time and feeling quite, you know, like it's all very strange walking back in the door and, you know, wondering what the world's going to look like, kind of thing. So I think it's really important that, touching on some of the stuff earlier, around being clear about what's happening, more than ever it's going to be important to do that and set the scene. So making sure people know what is the current scenario, where are we, what does it look like, what are the goals and targets that we're aiming for right now, because chances are they're probably different to the ones that they were working towards when they actually went off on their leave. So I think, you know, we all know, don't we, whatever the scenario, if people know what they're aiming for and what's expected, there's a whole greater chance that you're going to get them to do what you want, and achieve what you want to achieve. So I think more than ever, it's just really important at this stage to just make sure that it's a really open, transparent conversation that people are having, that understands where are we trying to get to, what's my part in all of this, and what exactly is going on. I think it's fair to say that, you know, wherever we can get people involved in decision making and setting of goals and targets, obviously the better it is. Like Sarah was talking about in terms of getting people's buy-in with the health and safety stuff and putting the rules of the game in around that. It's the same with this, isn't it, really? You know, if people are bought into it and taking part in setting where you're heading, then there's a far greater chance that A, they buy into it, and B, it gets delivered. And then just sort of the final thought around knowing your people. At the end of the day, I guess you know who are going to be the people that are going to come in and get settled straight back in and just, you know, sort of crack on, as my phrase is. Those that are likely to be nervous for whatever reason, anybody who's likely to have, you know, sort of challenges around getting back into work. And I guess it's about that age-old thing, isn't it, as their line manager, of knowing who you're going to need to potentially give the most TLC to make sure that people get settled back in and comfortable as quickly as possible to get them where they want to be. Certainly in terms of thinking about how you might be able to help yourself get geared up for that, you might want to think about things like questionnaires before people come back. So not only in terms of establishing what people's scenarios are, but also asking people about any nervousness that they might have, any questions or concerns they've got before they even come back into the workplace, but then also potentially doing some of that kind of stuff as well when they come in on a more one-to-one basis, to give people the opportunity just to get settled in and chat and have a little bit of your time as their employer to talk anything through that they might want to. And that's the getting settled back in part. So as promised, fairly short on my bit today. Any other questions?
Couple of questions. One is back on the face masks. That and normal wearing face masks is down to people's own individual safety, but in terms of wearing face masks now going forward, it could be a case of everybody's safety. And so is it any more of a disciplinary offence not wearing the PPE for those reasons? Just a minute, Sarah.
Sorry, before. Yeah, no, if you decide for whatever reason, health and safety reason, that any PPE is required, then if people fail to wear it, then you should really follow your disciplinary procedure and escalate that up to the point that if people persistently don't wear it, then it's ultimately dismissal from the business. It's no different in this situation to any other piece of PPE.
Yep, so I would agree with that.
Yeah.
We've got another one. Employers are putting in all the social distancing rules in place, but struggling with employees who are not abiding by the rules. Common response, how do they deal with it? So if the employees are not abiding by the rules.
So again, it's looking at your disciplinary procedure, because it's part of your safe system of work, and how you would deal with that is you would deal with it through your disciplinary procedure. However, with this, I would probably have a bit of leeway to start off with, because it is a very big culture change for people. Like I said earlier on, I went out and, you know, people got too close because we know each other, and, you know, it will happen. So I do think there has to be some understanding that it is a big culture change of how we think, how we do business, how we run our lives. So people will just naturally forget. But obviously, once, I think, Kat, obviously you'll explain this, but once you start with one person on the disciplinary, you've got to be consistent with that, haven't you? You know, because you can't let one person off. So you might give them a few weeks to get used to it, and then say, right, from 30th of May or whatever, this is now part of the company disciplinary procedure, and anybody caught persistently being closer than 2 meters, well, you know, as long as you're clear, isn't it, from a HR point of view, and consistent.
Absolutely, yeah. And it's like anything else, isn't it? I suppose you'll take every case in its own merits. I suppose you're going to look at somebody who, I don't know, like Sarah was talking about, someone chatting to her and getting nearer because it's what you do, versus someone that outright goes, do you know what, I think these rules are an absolute load of garbage and I'm not going to follow them. You would look at those two things very differently. But effectively, you would use disciplinary policy, and if people aren't following the rules, you would use the process to deal with it.
Another question that's come in on redundancy consultation. If we end up there, face-to-face or via Zoom, ? Some staff live long distance away. Do we need to unfurlough to have these conversations?
Yeah, and that's a great question. Do we need to unfurlough? And to be fair, that is a very grey area at the moment. The safe answer is it would be best to unfurlough people to attend those meetings, because you could argue that it's carrying out work, but it's not, being completely honest with you, it's not being defined clearly in the law at the moment. But in terms of how to carry out those meetings, obviously on a normal day outside of COVID, ideally we'd be meeting people face to face, wouldn't we, and doing that personal interaction. But given the circumstances that we're in now, maintaining social distance and the ways that we're adapting ourselves, then there's nothing stopping you from having consultations with people, either via Zoom, so that you can at least see each other as well as speak, or on the phone if that's not possible. I think we've just got to be sensible in our approach at the moment, and just make sure we are having those consultations, but doing it in a safe way, in whatever works best with people based on circumstances.
Okay. Anybody got any more questions for Kat at that point? No, there's nothing else coming through. So I'll do, thanks to Kat as well. We will be sending out the slides, and as I put in a recording of this on the BBIC channel as well. So thank everybody for this afternoon. What we're doing, as I say, it's the part of the Survive, Revive, Thrive, and this is as we're coming back into this is the second webinar that we've done, and we're at this point on the kind of start of revival, hopefully. And so it's a bit out of sync, but we thought it were important to get this one in fairly urgently. So next ones, we're going to be talking about communication and cash is king, which is more like beginning of the survival phase. We're going to move on to then getting your individual plans in place, opportunity to reset the business, look at the improvements that can be made in process planning, leadership, setting smart objectives, management information in workshop 7. Post-COVID HR will be seeing Kat again, and then sales 9, and then the 10th one as we get into evaluating and improving unconsciously. So we're just doing things with doing things naturally rather than having to think about it, and going forward and thriving. So that's the overall program. The help that's available, like I say, we've got more webinars planned. Any other topic suggestions, send them through on chat or question and answer, or email them through. Anything more that you want to see. So we're available for one-to-one chats, 30-minute free video triage sessions, as I said before, opportunity to discuss your individual situations. Please let us know if you want to take us up on that. And we've got kind of experience from the last crisis in 2008 to assist clients now. Help, we've got links with all the funding agencies and any specialism that any small business is going to want. I've got another question that's just come in, so before we actually finish, I'll just ask that question. If we unfurlough, then would we have to wait 3 weeks before the next conversation?
No is the answer. It's just a case of making sure that during a period of furlough, that period is at least 3 weeks in length to qualify for the job retention scheme. So you could, in theory, be off on furlough for 3 weeks, back at work for a week, and then back on furlough again. As long as it stays to be there for at least 3 weeks, you can claim again.
Right.
So it's not the gap in between that matters, it's the length of furlough itself, if that makes sense. And
the other thing which I clarified as well myself, that if you have, if your furlough periods span pay periods, let me just get it right. You don't necessarily have to claim for 3 week periods. You can claim for for a 5 week period and then a 1 week period to make you 6 weeks, which is 2 3 week periods, is what I've been advised as well. So that came up in another webinar that we did, and I'll ask that question, and that's what I've been told as an answer. Yeah, so it depends. So whatever date you officially come off furlough and go back to work, that's when your rate of pay goes back to the standard 100%. So however your pay run falls would enable you to put through the required amount of furlough leave. Yeah, in that pay period. Yeah. So if you started on the last week in March and got paid through to the end, your next pay period was the end of April, you could claim for 5 weeks in April, and if they went back at the end of the first week in May, which is 6 weeks, that then is 2 3 week periods, but you've only got 1 week to claim in May, and that's how you would do it. That's what I've been advised anyway. Yeah, it's based on the cut-off dates for when you can get it through with HMRC. If there's no more questions, I'll finish this one like I did last time. Call to action is anything that you're going to do as a result of these webinars, or this particular webinar, that you want to just let us know that I've got this, that and the other out of it, this is the benefit that I've got, and as a result of this I'm going to take this action within my business. If anybody wants to put their hand up and give us an example of what they're going to take away from it. No hands going up from there, but any last questions, feel free to ask. And if there aren't any questions, or anybody just wanting to share their experience of what they're going to do, what I'll call it a day there. It looks like a nice day outside, and thank Sarah and Kat for their input this afternoon. Hopefully it's been useful to you guys. As I say, the next webinar on the communication aspects is next Wednesday at 1 o'clock, and I sent the links out earlier for that one, and look forward to seeing everybody there then. Thanks a lot for your participation. I'll speak to you all later.
Thanks everybody.
Goodbye.
Thank you. Bye.
Bye.
Hi Sarah.
I've thought press leave, and I haven't. I press leave, and then it still says leave meeting. Don't know what I'm doing. Right, see you later.
See ya. Ta-ra.
Bye.